Temperature. Body temperature is a vital sign that reflects the specific degree of hotness or coldness of the human body. It is a crucial indicator of overall health, as the body maintains a remarkably stable internal temperature, homeostasis, for optimal functioning of its organs and metabolic processes. The hypothalamus in the brain acts as the body's thermostat, regulating heat production and heat loss to keep the temperature within a narrow range. Methods of taking temperature. Various methods are used to measure body temperature, each with its own advantages and considerations regarding accuracy and suitability for different age groups. It's important to note that readings can vary slightly depending on the measurement site. Oral, mouth, method. The thermometer probe is placed under the tongue, and the mouth is closed. The individual breathes through the nose to maintain a stable oral environment. Considerations. Wait at least 20 to 30 minutes after eating, drinking hot or cold liquids, or smoking for an accurate reading. Generally not recommended for infants, young children, or individuals who cannot hold the thermometer safely or follow instructions. Normal range. Around 36.4 ring operator C to 37.7 ring operator C, 97.5 ring operator F to 99.9 ring operator F. Rectal, anus, method. The probe, lubricated with petroleum jelly, is gently inserted about 1 to 2.5 centimeters, 0.5 to 1 inch, into the anal canal. Considerations. Considered one of the most accurate methods, especially for infants and young children, as it reflects core body temperature more closely. Normal range. Usually 0.3 ring operator C to 0.6 ring operator C, 0.5 ring operator F to 1 ring operator F, higher than oral temperatures. Axillary, armpit, method. The thermometer is placed in the armpit, ensuring it touches the skin and not clothing, and the arm is pressed against the body. Considerations. Less accurate than oral or rectal measurements, as it can be influenced by ambient temperature. Often used for screening purposes. Normal range. Typically 0.3 ring operator C to 0.6 ring operator C, 0.5 ring operator F to 1 ring operator F, lower than oral temperatures. Tympanic, ear, method. An infrared thermometer is gently placed into the ear canal to measure the heat emitted by the tympanic membrane. Considerations. Quick and easy to use, but accuracy can be affected by proper probe placement and earwax. Normal range. Usually 0.3 ring operator C to 0.6 ring operator C, 0.5 ring operator F to 1 ring operator F, higher than oral temperatures. Temporal artery, forehead, method. An infrared scanner is swept across the forehead, measuring the temperature of the temporal artery. Considerations. Non-invasive and generally considered accurate, with readings similar to oral temperatures. Normal range. Often 0.3 ring operator C to 0.6 ring operator C, 0.5 ring operator F to 1 ring operator F, lower than oral temperatures. Instruments used. Digital thermometers. The most commonly recommended type due to their accuracy, ease of use, and quick readings. They can be used for oral, rectal, or axillary measurements. Electronic ear, tympanic, thermometers. Use infrared technology to measure temperature in the ear canal. Electronic forehead, temporal artery, thermometers. Use infrared scanning to measure temperature on the forehead. Disposable single-use or chemical dot thermometers. Temperature-sensitive patches or strips that change color to indicate temperature. Less accurate than digital thermometers and primarily used for screening. Glass bulb thermometers, non-mercury. While historically common, mercury thermometers are no longer recommended due to the hazards of mercury if the glass breaks. Some non-mercury glass thermometers still exist but are less common. Clinical interpretations. The normal body temperature is often cited as 37 ring operator C, 98.6 ring operator F. But this is an average, and individual normal temperatures can vary. Factors like age, time of day, temperature is often lowest in the early morning and highest in the late afternoon, evening, activity level, and hormonal status, e.g., menstrual cycle, can influence readings. 1. Normal body temperature. Adults generally ranges from 36.1 ring operator C to 37.2 ring operator C, 97 ring operator F to 99 ring operator F, depending on the measurement site and individual variations. Infants and young children may have slightly higher normal temperatures due to a larger body surface area relative to weight and a more active metabolism. Newborns typically range from 36.5 ring operator C to 37.5 ring operator C, 97.7 ring operator F to 99.5 ring operator F. 2. Elevated body temperature, fever or pyrexia. A fever indicates that the body's set point for temperature has been raised, often as a response to infection or inflammation. Definition: generally, a temperature of 38 ring operator C, 100.4 ring operator F, or higher is considered a fever in adults. Ranges: subfebrile, 37.5 ring operator C to 38.0 ring operator C, 99.5 ring operator F to 100.4 ring operator F, mild fever. 38.1 ring operator C to 38.5 ring operator C, 100.5 ring operator F to 101.3 ring operator F, moderate fever. 38.6 ring operator C to 39.0 ring operator C, 101.4 ring operator F to 102.2 ring operator F, high fever. 39.1 ring operator C to 39.9 ring operator C, 102.3 ring operator F to 103.8 ring operator F, very high fever. Hyperpyrexia, above 40 ring operator C, 104 ring operator F. Temperatures above 41 ring operator C, 105.8 ring operator F, are considered a medical emergency and can lead to organ damage and be fatal. Common causes: infections, viral, colds, flu, bacterial, pneumonia, UTIs, fungal. Inflammatory disorders, autoimmune diseases, rheumatoid arthritis, lupus. Malignancies, cancer, heat stroke. Body overheats and cannot cool down effectively. Certain medications. Some drugs can cause fever as a side effect. Vaccinations. Temporary fever is common after some immunizations. Clinical significance. Fever is often a beneficial immune response, helping the body fight off pathogens. However, very high or prolonged fevers can be dangerous, especially in young children, risk of febrile convulsions, and individuals with underlying health conditions. Monitoring symptoms accompanying the fever is crucial for diagnosis and treatment. 3. Low body temperature, hypothermia. Hypothermia occurs when the body loses heat faster than it can produce it, causing the core body temperature to drop below normal. Definition: a core body temperature below 35 ring operator C, 95 ring operator F, is considered hypothermia. Ranges: mild hypothermia, 32 ring operator C to 35 ring operator C, 89.6 ring operator F to 95 ring operator F. Moderate hypothermia, 28 ring operator C to 32 ring operator C, 82.4 ring operator F to 89.6 ring operator F. Severe hypothermia, below 28 ring operator C, 82.4 ring operator F. Temperatures below 27 ring operator C, 80.6 ring operator F, can be fatal. Common causes: exposure to cold, prolonged exposure to cold weather or immersion in cold water without adequate protection. Certain medical conditions: hypothyroidism, diabetes, stroke, severe arthritis, Parkinson's disease, malnutrition. Medications, substances: alcohol, certain antidepressants, antipsychotics, narcotics. Extremes of age: infants and older adults are more susceptible to hypothermia due to less efficient temperature regulation. Trauma: severe injuries can impair the body's ability to maintain temperature. Clinical significance: hypothermia is a medical emergency. When body temperature drops too low, the heart, nervous system, and other organs cannot function properly, leading to serious complications and potentially death if untreated. Symptoms can include shivering, though shivering may stop in severe hypothermia, confusion, drowsiness, pale, cold skin, and slowed breathing, heart rate. Thank you.